Spinal nerves arise off the spinal cord and become part of the peripheral nervous system. So as you recall, when we did the vertebrae in the neck were called cervical vertebrae. The vertebrae associated with ribs were called thoracic vertebrae. And the vertebrae associated between the 12th rib and the iliac crest were called lumbar vertebrae. And then the vertebrae that were within the pelvis were called sacral vertebrae. So what we do is we divide spinal nerves based upon the vertebrae that they're associated with. So remember, when we put two vertebrae together, we get an intervertebral disc that separates them. Then we have an intervertebral foramen, and the nerves exit the foramen. So we end up with cervical spinal nerves, thoracic spinal nerves, lumbar spinal nerves, and sacral spinal nerves. And the pattern matches the vertebrae except for the cervical region. So if you'll recall, we had 7 cervical vertebrae, but we actually have 8 cervical nerves. And nerve 1 arises above C1, which is why that occurs. As we move to the thoracic region, then we had 12 thoracic vertebrae, and we're going to end up with 12 thoracic nerves arising in that region. Now when you get to the lumbar region right here, remember we had 5 lumbar vertebrae. We're going to have 5 lumbar nerves that arise. Within the sacral region, the sacrum, as you'll recall, fused, but it was a fusion of 5 vertebrae that forms the sacrum. So we have 5 sacral nerves that arise from that. And then we have a pair of coxial nerves that we see clear at the end. Now there's a pattern that occurs because during embryonic development, the nerves come off very segmentally, but they have to be rerouted as we form appendages like our arms and legs. So when nerves come off segmentally, as we're seeing right here, and then aggregate back together, then this structure is called a plexus. And so this we're seeing right here is the cervical plexus, and it arises from cervical nerves, the upper cervical nerves. And then this big plexus we were just looking at is the brachial plexus, and it arises from the lower cervical nerves to the upper thoracic nerve. And then notice in the thoracic area, we don't have this pattern where nerves come back together and kind of create this network. That in the thoracic area, each nerve follows a rib outward. And so there is no plexus in the thoracic region. And thoracic nerves follow a rib out from the spinal cord. When we get to the lumbar plexus again, then the nerves come off segmentally, and yet they reroute back together. So this is our lumbar plexus. And then the same pattern we see in the sacrum, where we have sacral nerves that come off separately, and then they come back together to form our sacral plexus. So this is another model where we can see that same pattern. So the yellow nerves here are coming off the upper cervical region. So this represents our cervical plexus. The blue, red, and green nerves here are coming off the lower cervical region in T1. So that represents our brachial plexus. Notice the brachial plexus gives rise to nerves that go to the arm. As we move downward through this area, this would be thoracic, so we have no plexus at all. Now when we get to this plexus where we have the blue, white, and red nerves, those are coming off the lumbar region, so those are the lumbar plexus. And as we see internally in the pelvis, all of the green nerves arising here come back together to form a plexus that we see here, which is our sacral plexus. So the next thing we want to do as we look at our plexus, and just to quickly review our cervical plexus, our brachial plexus, our lumbar plexus, and our sacral plexus. And then again on this model, we can see the cervical plexus, the brachial plexus, the lumbar plexus, and the sacral plexus. is we want to begin to talk about nerves that arise from them. So the nerve that arises off of our cervical plexus that we're going to talk about is called the phrenic nerve. And unfortunately, it's not done on either of these models well, but it innervates the diaphragm, and it's the nerve that helps you breathe. And so when we look at our brachial plexus, we're going to be interested in 3 nerves that arise from that. So remember, in anatomical position, the radius is on the thumb side of the hand, and the ulna is on the little finger side of the hand. So this green nerve that runs down the medial aspect of the arm in anatomical position and goes to the little finger and the 4th finger is the ulnar nerve. Notice the red nerve is running down the lateral aspect of the arm, and it goes to the thumb and the index finger. So that is the radial nerve. And the blue nerve is running down through the middle of the arm and actually does the middle fingers here. So it's the median nerve. So let's look at that again on this model over here. So notice on this model, this arm is pronated because the bones are crossed. Over here, the arm is in anatomical position because the radius and ulna are parallel to one another. Again, the ulna is on the little finger side, the radius is on the big finger side. So this nerve that's running down the edge of the ulna here is the ulnar nerve. It actually crosses in the elbow over the olecranon process. So when you hit your elbow, the nerve that you impinge is the ulnar nerve. And if you do it hard enough, your little finger tingles and your 4th finger tingles because of the impingement of the ulnar nerve. The radial nerve runs down the outside of the radius and then again goes to the thumb and the index finger. And then the nerve in the median, in the middle, is called the median nerve. And it actually crosses through the wrist in a tunnel that we call the carpal tunnel. And so people who do repetitive motions oftentimes get pain associated with this nerve. And so we call it carpal tunnel syndrome. And notice the nerve is supplying these middle fingers of the hand. So if we go back to this model and we look at the lumbar plexus, we have a couple of nerves that you need to know off the lumbar plexus, the genitofemoral and the femoral nerve. The genitofemoral nerve actually goes to the genitalia and the upper femoral region. So it's not done very well on either of the models. But this red nerve that runs underneath, so if we move this one out of the way, runs underneath this inguinal ligament is our femoral nerve. And notice it runs down the front of the leg and then ends up innervating the dorsum of the foot or the top of the foot. And so when we're looking at this again, this nerve arising here and coming off and running downward is our femoral nerve, staying on the anterior aspect of the leg. Now the 2 nerves that we're going to work on that come off of this sacral plexus is the really big one, and then it runs through the sciatic notch. So this really big nerve is the sciatic nerve. It runs on the posterior aspect of the thigh down to the knee, and then in the knee it bifurcates, and one of the branches follows the tibia down, so it's called the tibial nerve. The other branch follows the fibula down, so it's called the fibular nerve. And then they go beneath the knee to the plantar surface of the foot and innervate the plantar surface of the foot. So again, when we're looking at this model, notice that this leg is laterally rotated outward. And so what we're actually seeing here is the sciatic nerve passing through the greater sciatic notch here, continuing down the posterior aspect of the leg. In the popliteal region, it branches and bifurcates. One part of it follows the tibia down, the other the fibula down. And as you'll notice, it continues out the posterior aspect of the ankle and goes to the plantar part of the foot, whereas the femoral nerve is doing the superior or dorsal part of the foot.